Comparing the fractional laser treatment with the old treatment, the skin resurfacing treatment, we've got a much higher comfort, but we need more treatments. We don't treat all the surface, we just treat single spots. For the positive effect, the comfort of the patient is much higher in the fractional laser treatment. The indications for the fractional laser are the classical indications, for example, treatments in the face, like wrinkles, melasma, lines, pigmented disorders, everything we want to remove normally with a CO2 laser skin resurfacing. It's possible to do the treatment with a fractional laser treatment, but additionally we can treat all the areas of the body. So we increase the bunch of indications for the treatment of the neck, décolleté and the hands. These were always a problem for skin resurfacing treatment, and now possible with a very good result to treat with a laser, with a CO2 laser, with a fractional laser system. The CO2 laser is not only done for fractional laser treatment. I can use the CO2 laser even for the freehand mode, for example, for the skin resurfacing with a special skin resurfacing scanner, even with several possibilities with this other scanner. And for all the indications, I normally use the CO2 laser. Normally, all skin types, Fitzpatrick skin types from 1 to 4 is not a problem for the fractional laser. For the other skin types, for the darker skin types like 5 or 6, we haven't got till yet the experience whether it's as good as for the other skin types. Time will show whether the other skin types 5 and 6 after Fitzpatrick are as easy to treat like the lighter skin types. With the fractional laser system, we need several treatments. So as thicker the skin is, as better the results will be. So in the area of the lower eyelid, for example, we plan 3 or 4 treatments to get very good improvement. We can do more treatments, but normally after 3 or 4 treatments, a normal result is reached. The chin area, neck area, or the décolleté area improve even after 1 or 2 treatments, so it depends on the degree the patient expects. In the face, the distance, the time in between the first and the second or the following treatments should be normally approximately 4 weeks. The speed of the treatment is very high. So if I treat, for example, this area, it takes per side more or less 30 seconds. For the fractional laser treatment, it's not necessary to make any pre-treatment. If I treat a person who has got very often herpes in the area I treat, then I would recommend therapy against the virus, yes. But normally the pre-treatment, a special pre-treatment is normally not necessary. And after treatment, I just prefer a cream treatment for the next 2 or 3 days after the treatment, and then the normal and good skin care. An exclusion criteria could be the therapy with Roacutan 3 or 4 months before the treatment. I did some treatments during a Roacutan therapy and with excellent results without any bigger side effects, but I wouldn't recommend it in general. For the most patients, for the most areas, short pre-cooling before the fractional laser treatment is totally enough. In very sensitive patients, in very sensitive areas, we can use, for example, Emla cream for the pain reduction. From the side of the downtime, it's not comparable with a normal skin resurfacing. The downtime is a downtime light. So it's just redness for some hours, swelling, extreme low, maybe surrounding the eyes a little bit longer, And these little dots, they can appear after 2 days for 2 or 3 days. In the body, we have to think about that all reactions in the body are slower. So side effects will stay longer, and the other side effects will take longer till they are removed again. First, local cooling. Then the laser itself. So the local cooling is normally totally fitting to make a nearly pain-free treatment. The precision of the laser is very good. In focus 0.3 millimeters. After the treatment with the CO2 laser is gone, there's no bleeding on the patient side, so I just finish with just a cream, put on the treated areas. The patient is doing the same for the next 5 days, and then the healing process will be finished. To remove a nose and the forehead, we do it freehand with a continuous wave mode, but first we cool it down. Okay. And to finish, put some cream on it. For the freehand mode with a continuous wave CO2 laser. In this case, we remove some tissue from the scalp growing in the capillicium with a CO2 laser freehand. First, I cool down the area for the comfort of the patient with an ice cube. Then I take the laser. So. Cleaning and some cream on it afterwards. In this case, we do a test treatment. In this belly area, stretch marks, and we perform just one side of the patient as a testimony for the patient how it works. So first I cool with an ice cube in the treatment area. After the cooling, I dry the skin, and then the treatment. Everything okay?
Mm-hmm.
Fractionated scanner mode, just only a light overlapping. Short after cooling, with an ice cube, just some seconds to cool down. Especially for the patient's comfort. It's okay?
Yeah.
Good. So, here in this case, we do a treatment of the décolleté in the area below the throat, down here, and to the beginning of the chest, the typical décolleté area. Before the treatment, for the patient's comfort, I use an ice cube for cooling. So, nicht erschrecken. So, drying up the skin. So, and beginning to scan. Nicht erschrecken. Okay. Scanning with an overlapping of about 10 to 20%. Just an intercooling and drying of the treating area. And foaming the next seconds. So after the treatment, a light redness appears. The little dots of the scanning mode appear. I put cream on it. Here in this case we do the fractional treatment in the lower eyelid area, both sides, and the cheek area. This, and this. In this quite young patient, it's just to refresh the skin and to make a little bit more tension in this area. First for the eye protection, away it goes. Then for the patient's comfort, the skin cooling before the treatment. It's an octinisept ice cube, so it's local antiseptic. Cheek area. So, dry the skin again. And begin at the lateral part of the orbit. Okay, now cooling the cheek area. Okay, down to the lower cheeks, because there's some tension needed too. So, that's this side, after cooling. Okay, the after treatment, some healing cream on the treated skin areas. Okay. That's it. So in this patient we do the treatment with a fractional CO2 laser in the upper lip, from nasolabial to nasolabial fold. Upper lip, very sensitive area, especially for temperature, so before, for sure, a cooling for the comfort of the patient. The ice cube to chill down skin. Skin has to be more or less dry. So, Kopf mal ein bisschen zu mir bitte. Dankeschön. First scan. So, weiter, Dankeschön. In this scan, I do a full scan and a half line scan. Full scan, half, full scan, half size scan, full scan, half size scan. Nasolabial. Other side, please. Nasolabial. Some cooling again. So. Okay, das war's.
Gut.